What if a tiny scratch could kill you? Not a gunshot, not a stab wound, just a small puncture from a rusty nail, a thorn, a fishhook. At first, it stings. Maybe it bleeds. But you clean it, you move on. 3 days later, your jaw feels tight, your neck is stiff, your back arches involuntarily. Then your body locks up completely. You're awake, you're alert, but your muscles are clenching so violently, they're pulling your bones apart. This is not fiction. This is tetanus, and it does not let go. Before we take you deeper into the horrors of this real disease, do yourself a favor. Like and subscribe to uncover more terrifying medical mysteries. True stories that prove nature is far scarier than fiction. Now, let's begin. Tetanus is caused by a bacterium called Clostridium tetani. It lives in soil, on rusty metal, in dust, even animal feces. And when it enters your body through a wound, big or small, it unleashes a neurotoxin called tetanus spasmin. This poison hijacks your nerve. It blocks the signals that tell your muscles to relax. The result? Your body begins to seize up, one muscle at a time. It starts subtly. Stiffness in the jaw. That's why it's also called lockjaw. Then comes neck stiffness, difficulty swallowing. Suddenly, your abdomen hardens like stone. Your limbs contort. Your spine bends backward into a grotesque arch called Tetanus. You look like a human bow. Every muscle is flexing, without your consent, without relief. But here's the most horrific part. You're fully conscious. You feel everything. The spasms are excruciating. Each one lasts minutes. They come in waves, and they can be triggered by the slightest noise, a whisper, a flicker of light. Your body becomes a prison of pain. Now, picture this. You're lying in a dark isolation room because light and sound trigger muscle seizures. Your chest tightens with every breath, and you know if your diaphragm locks, you'll suffocate while wide awake. Tetanus has no cure. There is no antidote that reverses the toxin once it binds to your nerves. All doctors can do is support you, keep you alive while the toxin burns itself out, which can take weeks. You'll need a ventilator, muscle relaxants, feeding tubes, maybe a medically induced coma, and still the survival rate isn't guaranteed. The mortality rate for severe tetanus, up to 50% without intensive care. Even with it, the recovery is brutal. Patients can suffer long-term nerve damage, memory loss, and PTSD from the trauma. But here's a true story you'll never forget. In 2019, a 6-year-old boy in Oregon was playing on his family's farm. He scraped his forehead climbing a fence. Nothing dramatic, just a cut. 6 days later, he couldn't open his mouth. Soon, his body was convulsing in agony. Doctors diagnosed him with tetanus, the first pediatric case in Oregon in over 30 years. He was intubated, paralyzed with drugs to stop the spasms. Spent over a month in the ICU, over 50 days in the hospital. His treatment cost more than $800,000. The worst part? He hadn't been vaccinated. And even after surviving, his parents still refused to give him a tetanus shot. Let that sink in. Tetanus is entirely preventable. A simple vaccine, the TDAP or DTaP, can protect you for years. It's one of the safest, most effective vaccines in the world. And yet, tetanus still claims lives, mostly in areas with low immunization rates or in people who simply forgot their booster. So ask yourself, when was your last tetanus shot? Because this disease doesn't care who you are. It doesn't care if you're healthy, fit, or strong. All it needs is a way in. A splinter, a nail, a scratch from a rose. And once it's inside, it doesn't whisper, it screams. Thanks for watching. Stay curious, stay cautious, and remember, the most terrifying monsters are microscopic.